Hey everybody, my name is Darian Dozier and welcome to Melanated and Meducated.
Try to, navigate the city, navigate, gross anatomy and all of those other things.
Right. I applied to two HBCUs this cycle, and every school that I've ever been to, I've been the minority. So I was kind of hoping for that experience, but I think our school has done a good job of helping out with staff and faculty, trying to make up for that a little bit. I do really encourage, especially Black students, to look at HBCUs, see if that is something.
Undergrad.
Yes, because if I had known, I was at Langston University was about an hour away from me, and I was there any chance I could get. So fast forwarding a little bit more, how did you decide that you wanted to go into family medicine?
So the way I decided about family medicine really is that I like it's almost like a game show. What's behind door number one? What's behind door number two? What's behind door number three? It could be a man, it could be a woman, it could be a kid, it could be an elder, it could be a teen. And then it allowed me to do, okay, I like OB, but I don't want to do this all day, every day. So it allowed me to do that. I like orthopedics, but I don't want to do that all day, every day. I like orthopedics. I like casting. I don't mind setting your bone. I just didn't like orthopedic surgery.
Right.
I like, doing a colonoscopy and doing some procedures, but I also like coming in and say, let me make you what I call a Collins cocktail, and your throat will feel better before you leave out the office. Here, gargle with that.
Yeah.
So that's what led me into family medicine. And I could see patients inpatient, I could see patients outpatient. And it really, allowed me to kind of, as my career progressed, to change and to do a lot of different things in a lot of different places. And so it allowed me to continue to evolve, I think.
Right. And family medicine is so broad that you are able to walk in and see something different every hour.
Literally, and you can focus on different parts too, because when you take the family medicine board, after you initially become board certified, when you have to recertify, you have to pick two subspecialties after that. And so, you can focus in any of those areas if you like, or you can do ambulatory medicine, which means you run in a clinic and do it all. But um, it's so broad. And so there's so much that you can do, and that's really what attracted me to it.
And also, something else I envy about family medicine is that the longevity that you get to build with your patients, because some patients you're seeing them the entire time.
Right. You can see them from the womb to the tomb.
Yes, I definitely like that, because if you build that relationship, do you feel like your patients have better compliance? They take their medicine, they come see you more?
I think you get an understanding of them and their lifestyles. I've been fortunate to see patients, some families where I've seen four generations. Um, and so you begin to see that, you can see the dynamics, but I also may get more information about you that you may not know. I've had where parents and adult children both see me, and you can ask, well, do you have this in your family history? And the adult child is like, no, but I'm like, yes, you do. There's your mama, but okay, this is what we're gonna do. And they trust you, and families have the chance to trust you. And even when I stopped seeing patients outpatient and continuity clinics and that kind of thing, and start focusing only on inpatient. I've always seen patients out and in, but then when I really kind of pushed, I'm just gonna do inpatient. Um, when I first moved back to Nashville after I finished residency at LSU and all of that, and a couple of years after that, and went back, one of my first patients, I saw her, knew her, kind of got to know her family during that. And even when I stopped seeing her, if by chance she was admitted to the hospital, I'd pop my head in and say hi, or I may have been following her in the hospital, or see her at the grocery store or whatever. So there was that there. So one night I was on at the hospital, and essentially she was transitioning, she was dying. And I went in and spoke with her family. Her kids were there, grandkids, and I explained to them what was going on. And I asked them, I said, if her heart stops beating or she stops breathing, do you want us to resuscitate her, or do you want us to let her go peacefully? And their answer was, "You've been a doctor for all this time. You tell us what we're doing." Now, mind you, she had not, quote, been my patient for at least 6 or 7 years, other than if she came in the hospital. But the rapport was established that, hey, you've taken care of her, you know her wishes, you tell us what you think are the best option will be.
Right.
So you get a chance to establish that rapport with people and families by doing family medicine. I always tell people I have secrets that I don't, I am supposed to take to my grave unless I need to tell, or
Right.
something like that. And, where you make agreements, okay, I won't tell them, I had a gentleman who was in renal failure, going into renal failure, that may eventually have needed dialysis. And he was like, "Don't tell my wife, don't say anything. Let's work this out." Okay. I said, "We definitely hold that, but I am going to ask you that when I say, okay, now it's time to tell, that we go on and do it." And so he came in one day, and I was like, "We're at the time to tell. You need to go to the hospital. I'll call your wife." And he was agreeable,
Yeah.
at that time to that.
And I think building that patient trust, like you demonstrated in your stories, is so important. Because again, going back to not even just in the Black community, but in the community in general, how scary and nerve wracking it can be going to see the doctor. And so anything that can help reduce those fears is helpful.
Exactly. Exactly.
So while you were in medical school, while you were in residency, what were some of the big L's that you took, or maybe the biggest lessons that you learned? And then
Mm.
also, what were some major wins that you had?
I think in medical school, my biggest L was USMLE Step 1. Step 1 of the boards was a thorn in my flesh, literally. I mean, literally, as in I give up. I'm going to sell fish out the trunk of my car type of loss. I mean, it's kind of bad. It plays some mind games, but also it made me reach out and understand. I've always had test anxiety, even in undergrad, and to the point where I didn't do as well on some things as I should have because of it. And in undergrad, I didn't know. I ended up talking to our pre med guide counselor, Dr. J.W. Carmichael. Anybody went to Xavier knows him. Um, And so I told him, I said, "Gosh, I just have test anxiety. I'm kind of, I had good grades, but they could have been better,
Hmm.
because I was always having to make up a grade or make up something to balance it out because either I screwed up or did something like that." So I didn't know that there was a group or something to try to help people with that on campus. So he told me about it, and I went, and it helped for in undergrad. In med school, it blew up again. Even when I went to take the MCAT, I walked to the place because I figured if I passed out along the way, somebody would find me and take me to my mama's house or something. They would know me. But it would kind of let me kind of work out some of the steam before
Right.
I sat there. I learned to do in med school guided imagery where you sit and focus and get positive and how to deal with some of those, reactions and what to do. And so sometimes I wish I would have done that earlier. Um, and there's always a stigmatism and all of that. Now I'm old enough where I don't care. I'm going to do what I need to do to get through this exam the first time,
Right.
regardless of whatever test it is. Um, so that was a big L, but it was also a big win. I just hate that I had to feel the L so hard and deep
Yeah.
to finally get to that win.
I always say it takes 2 L's to make a W. So
Oh wow, that's cool. I like that. 2 L's to make a W.
so sometimes you just gotta bump your head and then figure it out.
Right.
So now kind of switching gears away from medicine, what do you like to
Okay.
do outside of work? Because I'm sure you don't just see patients all day, every day, and that's it. So
Yes, I do. I'm so focused on medicine that I don't do anything else out. It is my life. It is all that I live for. So, outside of medicine, I do things with family, of course, before the pandemic. I like to fish,
wow, okay.
saltwater fishing, a whole lot, a
What
lot.
have you caught?
I catch whatever comes out the water.
See, I'm
So, but
not
I've
outdoorsy,
caught,
so I
huh?
don't know. I'm not outdoorsy, so I don't
Really?
know.
I so snapper, grouper, catfish. We throw them back. Trout, um, red, Texas red, Louisiana red. Those are game fish. Bigger the better. I talk a whole lot of trash. I ain't gonna
And you go
lie.
to a lake?
No, I do not go to the lake. I don't do
Oh,
fresh.
where do you-
I do salt. I go to the ocean.
oh,
Maybe a river, but yeah, I know. Look, no, I anywhere I go, I try to fish. I like,
okay.
Gulf of Mexico, the Pacific, the Puget Sound, Hawaii, almost anywhere. If I can drop a hook, I want to do it. But
Ooh.
also on the other side, my cousin talks about me because I like farmers markets
Mm,
and we'll go to those. And I have some friends that we actually go to a food auction, a farmers auction.
okay.
It's yeah, we doing a bit much, but it gets to be addictive. um, but I was talking about because like you traveled all the way to Africa to go to a farmers market. I didn't actually travel there to go to the farmers market, but the
Just happen
farmers
to be
market was
there.
there, so I felt obligated
Just
that I
happen to be
need to go
there.
experience. But yeah, if it's a farmers market and I'm traveling somewhere, I'm gonna go. I'll probably visit the grocery store. I made a friend go to the grocery store with me in Paris. I'm gonna go.
So you like food?
I like I
Food.
like food. I like different cultures and looking at
Hmm.
different things. And it's not like I got thrown into food. So I come from a family of caterers. I became a doctor thinking I would not have to deal with food. It hadn't totally worked out, but that was that was a big part of it. It was like, what can I do that I'm not doing this?
Right.
Because my grandmother and my mom, their bonding experience back in the day was they get up and go to like 6 grocery stores and the farmers market and this person and that person. And it was an all day freaking event
Ooh.
that these green beans don't look that good. They look better over at so and so. So we're not gonna get these. We're gonna go back there and get them. And like, or you were sent out to go. Oh, they got a field of vegetables. We're going to pick them. You know.
Oh my
So
gosh, that's so funny.
some
I mean,
of it was a little hereditary.
I like food, but I'm just going to one store and I'm not even gonna go search for a good deal. Whatever the price is right here, I'll just grab it.
No, the sales papers come out on Wednesdays, Tuesdays and Wednesdays.
Every 2 months when I check my mail, I have a lot of newspapers and coupons and weekly deals. I'm like, I'm overwhelmed.
I say every 2 months when you check it.
Nobody sends me anything, so yeah. And everything is,
I had to send you a card in the snail mail or something.
everything's electronic too. So my bills are electronic. Everything's electronic. So yeah, I just go check it so the mailman doesn't get mad at me. How have you learned to balance having a family, being a woman, kind of having those familial obligations while also being a doctor?
I think some of it you kind of learn, work hard, play hard thing. Um, that kind of comes into play. And then some of it is, taking the time to do it and taking the time to do what you like. I kind of got thrown into some things. I have a bunch of kids, but I didn't give birth to any of them. They kind of, I don't know, they just kind of came along. But realistically, some of what happened, one of my cousins had breast cancer. And so I ended up uh, having part custody and co-parenting with her father with a 5-year-old. And so when she asked, I was like, okay, look, my rule with godchildren is like, you need to make sure they potty trained and don't try to down me because, I'm not trying to be about that life totally. Well, she died. And it was like, wait a minute, I got a kid. What is this about? Things that I think one of the times that when I really realized that, okay, you got to do all the stuff, we were going somewhere and I bought a dress. And then it was like, okay, where are your socks? Where's the, and it's like, dude, she don't have any socks because you ain't go get any. Go get the socks. Or you driving down the street and the little head pops up and almost scares you like, oh, where'd you come from? I forgot I had a kid. There's a kid here.
They're having another human with you.
Another human, but hey, she's grown now. She survived and we laugh about it.
I know she's got some great stories.
Right. She survived and so have all the other ones, which, it's kind of funny. They have survived. I had one and every time he was with me, he got hurt. And his parents, he come back with a bump or something. They were like, what happened? Nothing happened. He's fine.
And kind of the irony is sending these kids off with a doctor and then they might come back banged up.
They may come back banged up. It's not my fault. I didn't know I was supposed to catch him when he came off the large slide. Nobody told me that. So I watched him fly right on Bobby. We went to the pharmacy and got some candy and a little stuff to put on the Band-Aid. So
it's okay. Kids are parent proof.
right.
Just a couple more questions. Thank you again for talking with me. This has been a great talk. I've learned so much about you. And I think that this will be a really interesting video. How has being a Black woman in medicine kind of shaped your perspective on just the field or your position in medicine, or just kind of what's going on in the world in medicine?
I think a couple of things. One, Black women only represent 2%